Chapter 1, The Purpose and Promise of Special Education. This lecture will cover the big ideas in special education as well as the historical context in special education. For this lecture, by the end, you'll be able to define the big ideas, you'll be able to define exceptional children in person-first language, you'll be able to list the advantages and disadvantages of labeling students with a disability. You'll be able to name and define the 6 principles of IDEA, and you'll also be able to name and describe the major legislative pieces in special education. I'd like to begin the lecture asking you to consider your perceptions of special education. I want you to ask yourself, do you believe that students with disabilities can learn within general education? I want you to ask yourself what you believe is the general educator's role in educating students with IEPs. What role will the intervention specialist play within an inclusion setting? And if you plan to be a general educator, I want you to consider if you would be open to having students with disabilities in your class, and be honest with yourself asking why or why not. So take a minute to consider those questions. The 5 big ideas we're going to focus on are teamwork, effective practices, adult success, characteristics, and historical context. A great way to remember those is to remember the acronym TEACH. When we say teamwork is a large part of special education, if you're in special education, you'll see evidence of this everywhere you go. Very little is done at the independent individual level. Most of the work that's done for teachers and for students is all about the team. We see teamwork evidence in a lot of ways. Namely, when we think of special ed, most people think of the Individualized Education Program, or the IEP. That IEP is created by the IEP team. So many people have a say in what happens to students with disabilities. Parents, caregivers, grandparents, parent advocates, teachers, gen ed teachers, special ed teachers, speech language pathologists, administrators, the school psychologists, the students themselves. So everything is a team approach within special education. What I believe is one of the biggest ideas is the concept that effective practices should be used when working with students with disabilities. We know a practice is effective if there is evidence behind it that says it's effective. If we think about students with disabilities, they're generally behind their same age peers. The last thing we want to do is experiment with different interventions. What we need to do is do exactly what we know will work. We can't afford to have students fall further and further behind. Effective practices, evidence-based practices, research-based practices, they all mean the same thing. And they're all vital, I believe, for all students, but especially students with disabilities who may already be behind. Adult success can sometimes be a difficult concept when it comes to special education, especially for those who are going to be working with students at the early childhood level. But regardless of the age of the student, what should always be kept in mind is what skills will the student need to be a successful adult. So even if we're talking about preschool age students with disabilities, we have to be thinking long term. So for some students, it may be possible that success for them is defined by going to college. And at the preschool level, a lot of what we do will affect that goal. And then there may be some students who happen to be born with, let's say, an intellectual disability or possibly Down syndrome. And so it may be, even at the preschool level, we have to consider how we are going to define adult success for that individual. So no matter what level you're teaching, your goal for your students is always adult success. We'll spend a little bit of time talking about this. Within special education, you know that you will hear different names of disabilities. And when you hear that disability, you'll commonly think of specific characteristics of students who make up that category. And I'm fine with understanding that there are sometimes characteristics that are common. So, for example, students with autism. Most of us think of students with autism as being a little bit socially behind, socially awkward, a lot of problems with joint attention, with having conversations. WH questions are often a struggle. Sometimes there are behavior issues. So those are common characteristics for students with autism. However, I think that we need to be very careful in not letting what we believe are the common characteristics define each student. We have to remember that a student with autism is different from another student with autism. So every student with a disability is their own individual with their own strengths, their own weaknesses. The name of their disability does not define them. So even though you may find out as a teacher you're getting a student in your class with a specific learning disability, and you can look up what are the common characteristics to be somewhat prepared. But you also need to take time to get to know that individual student because it may not fall into the same categories as what you believe are the common characteristics. So we can acknowledge that these common characteristics exist, but I want you to pay special attention to each individual student and get to know them, not just what their disability says that they are. And finally, historical context. And this is just about understanding in special education where we came from, how far we've come, understanding the mistakes that were made in the past so we don't repeat them. So with any profession, it's important to understand the history. So just as a general review, I have this as a choral response, and we'll talk later in the semester about what ASR is and what a choral response is. But this is just for you to review on your own at home as you watch this. So T stands for teamwork. E stands for effective practices. A stands for adult success. C stands for common characteristics. And H stands for historical context. Make sure you know those. And this is just a general review. You'll see some of these questions on the quiz. So I may ask you, which big idea is this? The IEP team, the ETR team, the RTI team. The answer would be teamwork. Students with autism may display stereotypy, vocal tics, inappropriate vocalizations, poor social skills. Which big idea is this? Common characteristics. Explicit instruction, direct instruction, self-monitoring, peer tutoring. Which big idea? Effective practices. These are all examples of research-based practices. When you hear the term exceptional children, because this is an intervention specialist course, you tend to think of children with disabilities. But it's important to know that the actual definition of exceptional children are those that differ from the norm, below or above, so much so that they require an individualized program. So this also includes students who are gifted. So gifted students are typically above the norm, and so that makes them exceptional. The term twice exceptional is an interesting term. Many times this is not diagnosed, even though students who are twice exceptional do exist. What this tends to mean is that there are students who can be both above and below the norm in different areas. Most commonly, we see this in kids with autism who can have, you've heard of the term savants, so they can have very high intelligence and be very strong in certain areas, but they may also struggle in other areas. So it's possible that a student can be gifted in gifted courses and a gifted curriculum, but also be within special education and receive extra help in certain areas. And that term would be twice exceptional. Generally, what we find, unfortunately, is that many students who struggle are defined more so by those struggles and not necessarily by the strengths. So twice exceptional is not a term that you hear very often in schools. Typically, they tend to focus more on where the student struggles, which is the disability. These are just basic definitions that are important to know. These are SAFMEDs. They'll be in your flashcards. And these are just terms that come up within special education. The first is impairment. When you hear the word impairment, just think of a body part. So an impairment has to do with some sort of loss or reduced function of a body part. So again, impairment, think about the specific to the body. A disability is when this specific impairment limits the ability to perform tasks. When you hear the term handicap, I want you to think of the environment. So it's a problem encountered when interacting with the environment. So it's very possible that a person can have a disability and an impairment, but not necessarily a handicap. It's what the environment gives them access to that determines if it's a handicap or not. At risk is a term that you will hear throughout education, and it's used to describe children who have a greater than usual chance of developing a disability. So these can be students who had a hard time at birth. They can be students with a questionable environment, with poor nutrition. Right? So these are all students who can be at risk. So when I talked about previously handicap, I mentioned the environment. So it's important to know that people are not handicapped, environments are. When the environment's not accessible, people can't participate. And this is true with or without a disability. So how many exceptional children are there? It's impossible to say the exact number, but we do a very good job of estimating. So we do have a general idea. The reason why we can't have a very precise number is because there's different criteria. So there's not necessarily one criteria that every school uses in every state, across the country, across the world. So there's just not one uniform way that schools or facilities do that. In many countries, in many school districts, even around the United States, they have very strong preventative services that allow students to catch up before they fall behind, before they fall further behind and have a disability. Some schools do not have access to those sorts of programs. But if we can find a student early enough, give them lots of preventative services, catch them up, then that affects their ability to be counted as a child with a disability. Additionally, assessment in general is rather imprecise. It's not this perfect science. It's also possible that a child could be eligible at one time for special ed, but not at another, just depending on the types of interventions they receive. But what we do know, approximately, is that children in special education represent about 12% of the school-age population. So of all the students across the United States, about 12% make up special education. But almost 80% of those students are in general education at some point. And I hope this is impactful for those of you who want to go into general education, who are majoring in early childhood or majoring in middle childhood and so on, that 80% of these students, 79%, will be in your classes. And so it makes it extremely important for those who are going to be general educators to have some sort of knowledge and expertise in special education and in how to teach students with disabilities. We tend to think of labeling a student with disability as something that's very negative. And there are certainly some negative points to it, but there are also a lot of positives that come from labeling. It allows everyone to respond responsibly to the differences. In some cases, it allows for acceptance by peers. If we have a student that's extremely socially awkward, and to some kids, they may just think that's just a weird kid, the child may get bullied, but if we can label it sometimes, that makes it okay for the younger students. If they hear, oh, he's autistic, okay, that's an explanation, and sometimes that can lead to acceptance. In order to focus on a specific disability, we have to have that label. So if we know that autism exists, we know who has autism, we're able to really pinpoint all of the research that we do and the dissemination. It ensures funding and resources and promotes awareness. And we see lots of evidence with that within the autism world. And we know there are some disadvantages. The major one is that when you label a student with disability, it places a large focus on what students can't do. Right? So if we think about any disability category, the way it's defined is it defines student weaknesses instead of looking at the strengths of the students. Having that label can stigmatize them, and it's very disproportionate in labeling. It's become a little bit better, but what we see sometimes are certain genders, certain races tend to be labeled with disabilities more so than others. Labels often have permanence. Once you are a child in special education, that tends to follow you wherever you go. Sometimes, unfortunately, in some classrooms, teachers use labels to try to get kids away from their classroom. This most often I've seen happen with students with emotional behavior disorders. I've seen general educators say this child is not able to behave in my class. He or she has an EBD, and I don't believe they should be in my classroom. Instead of looking at the actual behaviors and the actual student, they use that label to get them out of their classroom. And there's a ton of time spent labeling a child with a disability. Tons of time, tons of resources. And so all that effort just to label a student could be placed on getting the student help. But unfortunately, that's just the way of funding in Ohio and all over the United States. When a child has a disability, and we will have a lecture later on this in the semester, there's a process that the student will go through. And at the end of the process, if it's determined that the child has a disability, the state of Ohio asks you to name the exact disability that the student has, that they'll be receiving services under. And there are 13 categories. So these are the 13 categories. You won't necessarily need to know these for the upcoming quiz, but you will need to know them for the final exam. So please get to know these over the semester. Major sticking point for myself is what's called person first language. Very often, especially when you're out in the field, you'll notice these things. Sometimes people refer to a child with disability as their disability and forget that they're an individual themselves. But if we think about it, people with disabilities have far much more in common with people without disabilities than they have things that are different, right? And nobody wants to be known just by one characteristic, especially if it's considered to be a negative characteristic. So I'll give you some examples. You don't want to say things like the disabled. Instead, you want to say people with disabilities. And if you look at that phrase, people with disabilities, that's what person first means. It puts the name of the person before the disability. So it says people with disability instead of disabled people. Mentally retarded is a term that is not used anymore. You should never use that term. It's not the appropriate special education term any longer. It's just not used. Instead, we say people with intellectual or cognitive disabilities. He's retarded should just never be said, period. But if you're specifically referring to the disability someone has, you would say he is intellectually disabled or he is cognitively disabled. You don't ever want to say things like wheelchair bound. It just doesn't sound good. You want to say he uses a wheelchair. This is what I hear most often. As a former teacher, I would always hear the special ed students or the ED kids. And within those two phrases, look at special ed students. That puts the disability before the person. ED kids, that's the disability before the person. Instead, you would say students receiving special education or students with behavioral disorders. Hopefully that makes sense, how you're putting the name of the person or the group before the actual disability, because it's the person that's most important. We also have started to move away from normal and abnormal, typical and atypical. And we never say, again, I mentioned this before, we never say mentally retarded or mental retardation anymore. We say intellectually disabled or intellectual disability. All right, now we're going to move on to talking about the history and why it's important to know about the social history of special education. Through knowing where we came from, it gives us perspective currently on all of the reform and all of the types of legislative pieces that are in play right now. Understanding the history also helps us understanding just the cultural context of a school. And also it helps us to make sure we're not going to make the same mistakes of the past. Additionally, for you all as students, that knowing the history is important for you within your licensure. And the OAE, the Ohio Assessment for Educators that you will all take for licensure upon graduation, some of you will take it during your methods classes too. There is a history piece, so you'll have to be familiar with the history. So what we do know is that special ed's past is what can be described as exclusionary. So if a child had a disability, they were not included in any way within schools. The options were basically to keep your child at home for their whole life You can send them to mental hospitals or institutions. Those were your options. And this was not just for students with, very low IQs or Down syndrome. This is for students with dyslexia. So it wasn't just students with severe disabilities, it also was the case for students with more mild disabilities. The video I'm going to show you is obviously an older video, but it does a really good job of explaining where we came from in special education.
I visited the State Institutions for the Mentally Retarded, and I think particularly at Willowbrook that we have a situation that borders on a snake pit, and that the children live in filth, that many of our fellow citizens are suffering tremendously because of lack of attention, lack of imagination, lack of adequate manpower.
It's been more than 6 years since Robert Kennedy walked out of one of the wards here at Willowbrook and told newsmen of the horror he'd seen inside. He pleaded then for an overhaul of a system that allowed retarded children to live in a snake pit. But that was way back in 1965, and somehow we'd all forgotten. I first heard of this big place with the pretty sounding name because of a call I received from a member of the Willowbrook staff, Dr. Michael Wilkins. The doctor told me he'd just been fired because he'd been urging parents with children in one of the buildings, building number 6, to organize so they could more effectively demand improved conditions for their children. The doctor invited me to see the conditions he was talking about, so unannounced and unexpected by the school administration, we toured building number 6. The doctor had warned me that it would be bad. It was horrible. There was one attendant for perhaps 50 severely and profoundly retarded children.
The ones that we saw were the most severely and profoundly retarded. There are thousands there like that, not going to school, sitting on the ward all day, not being talked to by anyone, only 1 or 2 or 3 people to take care of 70 people on the ward, sharing the same toilet, contracting the same diseases.
Can the children be trained?
Yes, every child can be trained. You know, these kids, there's no effort. We don't know what these kids are capable of doing.
And I think your priorities are mixed up in New York in terms of serving the retarded. Your top investment is in institutions. Our top investment is in the Department of Education and in providing a program for the child while he's at home in terms of daycare. For example, these kids can go to school at age 3 years. So they start at very young. That helps a great deal for parents. And when parents are actively encouraged to keep their child at home, they do so because they know they can have the help of regional centers or public schools or the health department in terms of services, etc.
What we need is a new approach. We have to change the way we care for our mentally retarded. We ask for change. We demand change. What you've seen here just doesn't have to be this way.
I think all of us are at fault. And I think it's just it's long overdue that something be done about it.
So you can see the sadness of that reality that used to be back in the 50s and 60s, and think of how the parents feel watching that. I know myself as a parent, it makes me sick to think that that's where my child could be, especially a child who has a ton of potential to be so much more, to know that's what their life would be. So I think it's always important, no matter what we're talking about. I know it's easy to get down politically on where we are with our government and making decisions about education. It's easy to be negative, but I think it's important to keep in mind where we came from and understand that that's where we used to be. So we're making progress. We all have the best interests of children with disabilities in mind. So I just think it's always important to remember those things. It all began with Brown versus Board. And hopefully everyone's familiar with Brown v. Board. But Brown v. Board was not about disabilities. I think we all know that from history classes. It was obviously more about race. But what it did do was it showed the specific group of, let's say, parents of children with disabilities. It showed them this huge social movement being moved forward with passion. And I like to say it kick-started the special ed movement itself. Another common piece of legislation is Park versus the Commonwealth of PA. And what this did was it gave students access to a free, appropriate public education. So what they found was there was a student who, and you'll read about this in your textbook, who was denied access because to their local school district because the child had a disability. And so, of course, a group of parents got together and fought to change this. And so it determined that all students will have access to an education that's free through their public school or a place their public school will provide, and it's appropriate, that meets the needs of all of the students. And so many court cases, but especially Park vs. PA, was incorporated into IDEA, the Individual Disabilities Education Act. So IDEA is probably what I would say is the most commonly referred to legislative piece in special education. Everything that you do as a special educator will come from IDEA in some way. It originally was called Education for All Handicapped Children Act. It then had been amended in different ways. But what we see currently is that there are 6 major principles within IDEA. And that's what we're going to talk about next. I do want to make mention, if you see towards the bottom of this slide, that RTI can now be used for identification of a student with a specific learning disability. A specific learning disability is an Ohio disability category that we saw a few slides back. And the way we know if a student has an SLD is we take a look at response to intervention model, and we'll talk about what response to intervention is, but I just want you to keep in mind that previously it was determined that a student had an SLD if they took tests, and those tests determined that the student should be getting better grades than what they are, and we call that the discrepancy. So if a student tests high, has a high IQ, they should be getting good grades. If they have a high IQ and they're not getting good grades, that's how previously it was determined that a student had an SLD. But response intervention is much more comprehensive model where students are getting evidence-based practices, where they're assessed regularly, where they're getting regular intervention. And then they collect that data to determine if an SLD is present. That's the more common model today, RTI. So just keep that in mind. So the 6 major principles, these are what you will need to know. You should be able to list these. You should be able to define these. And we'll go through what each of these are. The first is zero reject, and it's pretty self-explanatory. If a student lives in a school district, that school district must educate them. So whether the student has a disability or not, that district is responsible for that student's education. If for some reason that that particular district can't provide for the needs of the student, they're financially responsible to find a facility that can. The second is a non-discriminatory identification and evaluation that says schools must use non-biased, multifaceted methods of evaluating whether a student has a disability or not. And we'll talk further about what this is when we start to talk about the ETR, or the evaluation team report process. The third principle is a free, appropriate public education, and we talked about this a couple slides ago with Park vs. PA legislative piece. This is commonly known as FAPE. And I highlighted the word appropriate because what's important about FAPE is that it's, yes, students are allowed a free education, but it can't just be shoving a student in a particular classroom. The term appropriate carries a lot of meaning behind it. What makes the education appropriate for a student is the IEP, is the large document that outlines the student's needs, their strengths, their weaknesses, their goals. So that IEP is what makes it appropriate. So if you hear the term FAPE, or we talk about free appropriate public education, please always associate that with the IEP. Hopefully everyone's familiar with what the IEP is. You're more than welcome to Google it. But we will be seeing an example of an IEP, and we will have a particular module on the IEP in a few weeks. The IEP is what is by far the largest focus of an intervention specialist. The fourth principle is the least restrictive environment. So this says that students who have disabilities must be educated along with students without disabilities to the largest extent possible. So what commonly happened was if you found out a student had a disability, you would put them in the basement classroom with all the students with disabilities. You'd lump them together. But we know each individual student is different. So some students could function very well within general education if they just had a little bit of help. Right? So there's many different levels of disability, and your goal, what the law says, that students should be with the general education students as much as they possibly can while still being successful. Due process safeguards just means that there is a legal recourse for all students with disabilities. And finally, shared decision making. And we see this when we talked about the 5 big ideas, teamwork. And it's the same concept legally, that schools have to collaborate with parents. All right, when you hear the term least restrictive environment, we'll go back to that other slide. A lot of people hear LRE and think that's inclusion, but it's not. You'll know better that least restrictive environment is very much individual and based on the student. So if you think about the term the least restrictive environment, what's least restrictive for a student with a very low IQ is different from the least restrictive environment for a student who is gifted. So we have to know the student in order to understand where the environment is that they will be least restricted. Right? So don't always assume least restrictive is inclusion. You could have students with very high need who have very intensive disabilities. Their least restrictive environment is going to be a hospital setting, or it's going to be a self-contained classroom. That may be as close as they can get to general education while still being successful. Right? So just make sure you know that LRE and inclusion are not synonymous. LRE is determined by the student need, and it depends on the student's individual goals and objectives. So here are the options, the general options. So if you find out a student has a disability, you immediately as a team consider where the student will be educated. And these are essentially the options that you have within each district. If we look to the left, it says out-of-class supports. These tend to be the options that are least intrusive. You may have students who you determine, yes, they have a disability, but they only need consultation, which typically means meeting with intervention specialists outside of class once a week, once a month. I had a student at the high school level who was in all AP classes, but was ADHD. And so she was very successful, but she needed a lot of help with organization. So she was consultation only. We would meet once a week. We'd take a look at where all of her classes were, where she was on all of the projects, and we would organize her binders. And that's all the help that she needed. And then often what you will see in the middle, the red, in-class supports. So some students may qualify for special education services, but just need some support such as inclusion or co-teaching. And then finally on the right are the more restrictive. So that would be where a student is placed in a resource room or in a self-contained classroom. All right. Finally, just to talk a little bit about No Child Left Behind. No Child Left Behind, I think most people in education are familiar with, and everyone thinks it's rather new, but it in fact took place and enacted originally back in '65, so a long time ago, and was aimed at helping children from lower income families. It wasn't until 2001 it became No Child Left Behind. And this was because a lot of times, it was directed at low income families in some ways. It continues to be. But the idea is that all students, no matter what district they're in, no matter what family they're from, no matter their socioeconomic status, should be able to be at a particular level in reading and math. And so that was the concept behind No Child Left Behind. It was just holding schools accountable for making sure all students are able to read, all students are able to do math. And so it's expired at this point, and so there's definitely some work on where we're going to go next politically. It's a large discussion going on. But the concept was that all students had to be, all schools, all students, 100% passage rate by 2014. And what we found was that that wasn't possible. Even the schools that were at 96, 98% to begin with, they just were never able to make sure the other 2%, 4% were able to pass. At its roots, there was a focus on accountability, holding schools accountable for the success of all students, and focusing on using scientifically research-based programs, which are both great things. So a lot of good came from No Child Left Behind.